So for my project, I wanted to look at the US National Dietary Guidelines. So for part one, first I want to describe the American National Dietary Guidelines and what they consist of and what they suggest an American should consume. I'll look into when it was established and how did the guidelines change over the years, and also who set these guidelines and what do doctors have to say about them, and do people actually follow them and do they work? So for part two, I want to look at the pros and cons of them, and I'm interested in seeing if it's effective and also how it varies from other countries. Is the guidelines effective for everyone? Is it really working, or are there other guidelines that would be more effective? I want to compare the US dietary guidelines to other countries and their national guidelines and compare their different health outcomes to see if a certain diet is more effective, just like how we were looking at Canada's national guidelines in class the other day. I want to look at different controversies and issues of whether this is the optimal guide that all Americans should follow, and are people realistically able to follow them? How can these guidelines be changed, and how are they efficient the way they are? Then I want to look at how people are all different, so how could one set of guidelines be effective for all of them? Should everyone stick to the same plan? Does this vary by gender, age, or size? I want to look at how different cultures may not be able to abide by these guidelines. And on the economic side of things, I want to look at how much it would cost to abide by these certain guidelines. Some people don't have the means to afford healthy options, and what can we do to help them access healthy options? Do the US guidelines also uphold the same standards as other countries, and are they working? So for some ethical considerations, I want to look at the Department of Health and Human Services and the Office of Disease Prevention and Health Promotion. What is their role in dietary guidelines, as well as what is the government's role in dietary guidelines? I want to look at what types of educations are out there so Americans can be educated on this information, and also what is the funding surrounding these guidelines, what funding created them and upholds them, and also what happens if someone isn't able to afford to eat like this. Will there be funding there too? I also think it's important to look at doctors and healthcare professional opinions versus government opinions, because I think they will vary. And then to summarize it and conclude, I'll include an overview of each part, summarize what the American National Dietary Guidelines are, who established them, what do they suggest, do they work, and then comparing them to other countries' guidelines to see which country has the best guidelines that have the best outcomes, and then also a quick overview of the different perspectives and controversies, and what is the future holds for these national dietary guidelines. Will they change over time like they have, or will they stay the same? And then here's some sources that I've looked into that I think will be worthy into using in my project.